I was a gymnast in college. My original symptoms were just constantly irritated shoulder, couldn't sleep at night. My rotation was being limited a little bit. I ran a race and did some additional damage to my shoulder, and I knew Dr. Putney through some mutual friends, so I scheduled an appointment to come see him.
For shoulder rotator cuff tears, you seem to have two groups of people that it happens to. One is young athletes who sustain some sort of sudden injury or pop when throwing a ball or playing tennis. And the other group of people is older people who probably through wear and tear gradually wear a hole or a tear in their rotator cuff and it finally gives. He was in that category of people where his injury was more sudden and traumatic, and certainly that's why we approached him in a much more surgical fashion.
My other options were very limiting. If I wanted to continue to do anything, particularly working out or playing golf, therapy would only buy me a little time. It wouldn't fix the problem. So surgery was really the only way to take care of the problem.
We treated David arthroscopically, and we went in and sewed back his torn tissue back to the bone. People may ask, how do you sew something to bone? We actually, on the rotator cuffs and the labrum, we actually will drill a hole in the bone and put an anchor that has stitches in it, and then we sew the tissue to the bone.
My shoulder after surgery is starting to feel, I'm still going through rehab. I'm only about 3 months since surgery, so I'm still in rehabilitation. So it's still a little bit of the recovery, a little soreness to work through, but I feel like I'm on the right track to be back and fully active again.
I think another month or two for David, and he'll really be seeing a lot of improvement. I think he's right at that point where things are starting to turn around in regards to both his strength and his range of motion.
I've been a big proponent of Dr. Putney's. I've told a lot of people, that he did a great job. I think he interacted well. I feel very confident in, his ability to kind of get people back to where they need to be.